MS, FRCS, FICS, Diploma in Urology, and present affiliation is Senior Consultant at Indraprastha Open Hospitals, Delhi, and Senior Consultant, Urologist and Andrologist and Robotic Surgery, recipient of 1960, 1996 and 97 International Japanese Organization OISCA Award, founder President of Andrology India, and currently President of Delhi Andrology Society. Please, sir, I would like to take the stage.
Salesman. He thought, why not use it in human beings? The cows look so happy. So there he went, one fine weekend, he got the robot home and applied it to his penis. Sure enough, he had a lovely orgasm and the most amount of fluid that came out. But then came the problem. Try as much as he might, he couldn't take the robot out of the penis. He got stuck. Half an hour he struggled with it, then he had to call up his boss. He could sleep. Boss gave him 5 or 6 choices, garis, and then said, take out the instruction booklet. As soon as he read the instruction booklet, the salesman fainted. In this instructions were written, auto release after 250 liters.
Oh, 250 liters.
So not all is hunky-dory in the present instruments and present modalities. When Dr. Venkat gave me this topic, my friend and chairperson, I thought to myself, what a lousy topic. Robots and sex. But believe me, ladies and gentlemen, when I looked into the internet, it was amazing. The whole internet seemed to be full of its papers on robot and sex. So I'll just give you a glimpse of it. Let me divide the robotic era as a past, present, and future. In the past, we only knew about one action, and that is as a medical instrument. Very good for pelvic surgeries, and this is how we started. In 2005, I did a conference at Scott Heart Institute, the first of its kind in Asia, and this is the robot we had at that time. Now, since that time, things have changed. It doesn't look a robot in any way, but it's brilliant. Especially in pelvic surgery, where it improves tissue dissection. There's less blood loss, there's early recovery, and improved vision, which creates a less margin of error. But there were 2 problems with robotic surgery in the pelvis. One was incontinence, and the other was impotence. Incontinence we got hold of. This we were talking about. Soups, salads, sex. Sex itself is in your routine, and one of the best exercises. So is swing. By swing, I mean exercises like yoga as well. Stress. It cannot be avoided, but it can be modified and made easy. Sleep is important. 10 hours of sleep, but I appreciate that in these modern times, 6 to 8 hours are possible, which should be done. So smoking, spirits, alcohol, sweets are no. This is, and last but not the least, S for Saxena. By this I mean andrologists, sexologists. If lifestyle modification does not work, go and see a good sexologist or an andrologist, and he'll probably put you on oral medication. He may give you a vacuum device. There are supplements which are coming up. And last but not the least, let's not forget penile implants, which can be life-saving in many cases. I did one implant, and as is the routine, I call them after 6 months. I said, well, young man, Mr. Singh, you're a very good man from Amritsar. And I said, Mr. Singh, how are you? His wife didn't seem too happy. I got both of them. Mr. Singh said, yeah, I'm okay, but the wife said, I'm not okay. He says, everything's all right, but I said, go on. Everything is all right, but थोड़ा छोटा है. Now, you can't tease everybody. And as I said, technical age still has its limitations. Then there's another one where I did an implant and the man was not happy. I said, what's your problem? He says, every time I have sex, every time my wife wants to have sex, she presses the button and I have to perform, whether I like it or not.
The button is under her control.
That's what I thought, that we must have a remote control. Anyhow, so, playing with this one. There's no doubt that technology has made life easy in countless ways. But there are side effects. A laptop, imagine the laptop which is used for over 1 or 2 hours excess of the normal time, increase the ED by 3.5 times. 3.5 times is a hell of a lot. And when the small instrument can give you a bunch of side effect, imagine an instrument like a robot, both of which work by electromagnetic waves. These waves kill the function of the penis. Let's talk about the present. Presently, the robot has come into being as an advanced sex toy. And as I said earlier, I was surprised at the amount of things that are present in the internet. Now let's look at this rubber dolls, the dildos. What have they got in common? Rubber dolls and dildos. What have they got in common? Sorry? They don't have any emotions. Neither the rubber doll nor the dildos. They are mechanical things and don't have emotions. And that is where the robot scores. Using the artificial intelligence, now it is possible to give some emotions and preliminary answers to the robot. So it's more interactive nowadays. The robot can talk and answer back simple questions. Hopefully in the near future, the AI will become so good that it will strike up a conversation on its own, and then we'll have it. Because the advantages with robot, it can be programmed to your satisfaction and not to the lady's satisfaction, and vice versa. There's total control over the partner. So many times, how many of us have faced that as well? So many times, the woman says no at the last minute because you've had a fight over something trivial, and she says no. And the man has had a pill take in the morning. So he doesn't know what to do with it. This is not a problem with the robot. It will do as you want, when you want, and where you want. Total control. There are no worries about erectile dysfunction and PE. Robot will carry on regardless. It can firm penis. You will just go to program it accordingly. Having said that, a lady who had all life faced PE from a partner and was very frustrated, she embraced the robot very nicely and programmed it for 15 minutes. 15 minutes, where the average is 5 minutes. She thought she had a good time. Little did she realize that the robot won't stop. It just carried on for 15 minutes, and what should have been a good event became something like a car statement of, was it? I try to figure the name of the person who said that. And every time he comes on the car, it looks like he'll be great. And the same feeling she had. The other thing is guaranteed to perform. As I said, emotions are limited. Not only that, you can program the affirmations during the sex time. You can make sex noises during having sex to your satisfaction. And you can obviously cuts down the STIs. That's not all. You can have sex with your dream companion. Let me give you an example. You like an actress or people like an actor. You can only dream about having sex with them. But now you can go to the robotics sex shops and you can get a customized robot made it look exactly like the actress. And there you are, you have had your own dream come true. Then women who are fed up with the men, what do? Go to the robot. Many men say that it's much easier than trying to please a woman. Women are very complicated things. With due apologies to the women in this audience. And sometimes, as I said, they may not cooperate with you. No such problem with a robotic woman. And you know, as I said, customized color, hair, vagina specification, and even the penile length can be customized. But whatever has got advantages are also got disadvantages. Firstly, you program a robot, it does everything you have to program every time. It becomes so predictable that after sometimes you forget about it. I'm okay on my own. So that has to be corrected, and AI will probably do it. Again, program can backfire, resulting in sensitive areas, including penile amputation or vaginal laceration. So what started as a good event turns out to be a bad one. Over serious program. I just told you about the woman who cried for 15 minutes and got the shock of life. Battery failure, that's interesting. What happens is the robot is on the woman, or the woman is having oral sex with the robot, or let me put it the other way. Robotic woman is having sex with the man. She's got the penis in her mouth and the battery goes off. Now what do we do? It's very embarrassing. We can't take it out, as I said earlier. It won't come out. And we have to take the robot to the docking station and get the battery charged up before he can get his penis back to himself. Then men and women can be redundant. Over a period of time, robots will take over everything, including the sex life, and men and women will become redundant. This is a forecast. There's also an ethical question of whether if you are having access to the robot, is it cheating or is it just extended masturbation? Something to ponder about, I think. There's no haptic responses yet, but things will develop. Haptic responses, response to touch, that we don't have as yet. Robots are the future. More and more workshops are coming where robots will look exactly like the human beings. And this is going to come in the near future. As I said, more emotions with improved artificial intelligence. And this is interesting. Sex workers may be replaced by robots. When you go to a robot brothel, find out the robot of your choice and be happy. Similarly, virtual relationships and online dating are things that we have to see with the future of robot. Personally, ladies and gentlemen, I would want a robot that does all the hard work and the man gets the pleasure lying on the next door house without having to do any hard work. Thank you, ladies and gentlemen, for your patient hearing. I agree with this. Is this a robot or human being?
Can I have it? Sir, the robot which you are developing, the If the repeat and entry fails during sex, what will happen?
Explosion happening?
T and the entry fails during the oral sex.
Yes.
And then what will happen?
Very interesting situation. Especially if the man tries to take his penis out. I won't do that. Just go to the docking station regardless of how embarrassing it is. Thank you very much for your attention.